Hi, this is Sarah Mikesell, and today we're here with Dr. Derald Holtkamp. He is an associate professor of veterinary medicine at Iowa State University. So thanks for being with us today, Derald.
You're welcome, Sarah.
Could you tell us a little bit about the economics of PRRS?
Sure. Back in 2010, we had the opportunity to study that and estimated that annually the PRRS virus costs the industry about $664 million in terms of lost productivity. Wow. And if you break that down into number of pigs lost, it's about 9.9 million pigs lost per year, and that counts all reproductive losses and losses in growing pigs as well. And if you think about that, that's larger than even the smallest estimate or the largest estimates that were made for PED virus. So, yeah. So PRRS is more devastating every year than PED was, even at its worst.
Even at its worst. Wow. And it is the #1 issue, right?
Yes, really.
For hog producers?
Worldwide. It's the #1 issue, I would say. Yeah.
Very good. Now let's talk a little bit about diagnostics and what role do diagnostics play when it comes to PRRS?
Sure. The last 10 or 15 years, we've made some real progress towards being able to better manage the virus, and specifically the idea that we're either going to control the virus or eliminate the virus. And you know, one of the tools that we now have is the ability to classify herds. And to do that, though, we need to have very good diagnostics to do that. And so diagnostics play a key role in managing the virus.
And what are some of those specific things that diagnostics help farmers identify or see?
Yeah, so in terms of being able to stabilize farms after we have outbreaks, and basically what we mean by stabilize is to walk the virus out of the herd.
Right.
To do that, you really have to be able to monitor the current status of the herd, and you have to do that in a regular way. So typically what we do is monitor weaned pigs by PCR to determine if they're still infected as they're going out, and once we get them to a point where we're reasonably confident that they're no longer infected, we start to become more comfortable about calling that herd stable.
Very good. And that has to occur in different parts of an operation, right? When you've got lots of different groups of pigs, I guess.
Right. So other specific things decisions that we have to make where diagnostics play an important role is once we get a negative pig, should we vaccinate that pig? And that's likely going to depend maybe on where we're sending that pig or the risk of that pig becoming infected during the growing period. We also may be needing to make a decision about whether or not we're going to commingle those pigs with pigs from another sow farm. And so understanding the PRRS status of both of those sow farms is going to be important. Other decisions that we may need to make or may want to make that diagnostics are going to help us with are biosecurity issues. And so, for example, we may want to route trucks in a specific way or people in a specific way, specific order from farm to farm. And so knowing the PRRS status is going to be important for that as well.
Mm-hmm. Very good. Well, thank you so much for your time and all the information today.
You're welcome, Sarah. It was a pleasure to be here with you.
Very good. Thanks.